Hello, my name is Abigail Milam, and this is my Purdue ID. Growing up with two parents who worked for Microsoft gave me an increased appreciation for all things technological. While virtual reality was always of interest to me, I thought it was something that was solely for gaming. However, virtual reality technology opens up new opportunities for medical training and treatment, which ultimately improves both the quality and the accessibility of these experiences. Virtual reality technology is currently being used as a resource to help train medical residents. According to a University of Michigan study, 30% of surgeons were unable to operate on their own following the completion of their residency. This technology allows residents to work through a surgery step by step from start to finish while being led by a virtual instructor. They are able to safely see the procedure and perform the operation, gaining experience that they would be unable to have in the medical field without the potential of hurting the patient. This technology is also being used to assist surgeons in their upcoming operations. They are able to see exactly what they will be operating on at a 360-degree view, which shows things in more detail than regular scans such as MRIs and CTs do. This allows them to plan their operation step by step, ultimately improving the accuracy and the survival rate of their procedures. According to Stanford doctors, this technology is being used for brain and spinal cord surgeries because these body parts do not move with blood flow and breathing. However, with the further development of this technology, it will eventually be able to be used for all procedures. The technology is also being used to educate patients. It provides relief as the patients are able to see their specific case rather than just viewing their condition on a model. It is specifically comforting for patients who don't understand English very well, as they are able to see in real life what the surgeon will be doing step by step. Some hospitals are even allowing their imagery to be downloaded and sent home as a souvenir of the patient's survival. Additionally, therapists can use VR to treat post-traumatic stress disorder in military personnel returning from war. The technology allows therapists to simulate the difficult environments such as war in a safe way. They are able to create stressful environments in a controlled fashion while simultaneously monitoring the patient's reactions to certain stimuli. According to Albert Rizzo, clinical psychologist at the University of Southern California for Creative Technologies, the therapists are also able to control the emotional intensity of the stimuli while simultaneously monitoring the patient's reactions to determine the specific cause of their post-traumatic stress disorder. They are able to examine which aspects cause the patient's stress, and they are able to then work through those specific stimuli step by step. Since they're in a low-threat environment, the patients are given time to process their feelings, which, when this environment is combined with relaxation therapy, helps them to realize that it is no longer a threat. According to the Industrial Psychiatry Journal, once patients realize their fears are no longer a threat, they are one step closer to overcoming their post-traumatic stress disorder. Additionally, therapists are able to replay certain parts of the stimulations infinitely, which ultimately helps their patients understand their fear in a more developed way. This technology provides a previously unexplored avenue to help treat these disorders. Virtual reality is ultimately used in many different ways, and these are only a few examples. Once this technology is even further developed, it will help doctors and therapists in more ways than we can imagine. These are my sources.